Thanks so much for tuning into the program today. I'm your host, Neal Howard, on Health Professional Radio. Our guest today is Dr. Daniel Schwartz, co-founder and medical director of QxMD, clinical assistant professor at the University of British Columbia as well. And he joins us today to talk about QxMD and how his company creates point-of-care digital solutions for practicing healthcare professionals. Welcome to the program, Daniel, and how are you?
I'm great, Neil. Thanks so much for having me.
Now, QxMD, you're the one of the co-founders. What exactly is QxMD involved in? Are you exclusively involved in these point-of-care digital solutions for healthcare?
It's a great question. So QxMD is focused on taking the evidence behind medical practice from the primary medical literature and getting it to the point of care so that it actually impacts real patients. How do we do this? We, a long time ago, recognized the value of mobile technology and the rise of mobile applications. And we build mobile applications which allow a doctor to answer questions at the point of care. If you want to apply a prognostic tool but can't remember it, you can open our app, calculate, look it up, and apply it to the patient in front of you. If you want to keep up with the latest medical research that impacts patients, you can use our app called Read, and it will alert you of relevant medical research that you should be keeping up with to stay at the cutting edge of your field. If you look after critically ill children in the emergency department, you can use our app, PDStat, to figure out the right medication to use at the right time in that patient's critical course.
Basically, you're developing several different types of apps. Now, you talked about Calculate and Read and the pediatric app as well. Are there any apps that are developed or in development where the doctor can actually interact, maybe prescribe drugs, that sort of thing, or is it strictly informational?
Yeah, we've tried to stay away from applications which interface with, say, electronic health records. Mm-hmm. We're really focused on creating high-quality educational resources which help people make the right decisions, but then they'll use their existing infrastructure, the EHR, the paper pen in front of them, to actually implement those choices. So we're predominantly focused on helping people make the right decision rather than actually implement those decisions.
Are your apps more user-friendly or more healthcare professional-friendly, or do they seamlessly bring the two together without one being at an advantage over the other as far as the app is concerned?
It's a great question. In fact, one of the things we really pride ourselves on, and I think one of the ways we really differentiate, is recognizing that healthcare providers are software users just like anyone else. And people love simple, elegant software, which is what we built. Software that you don't need a manual for, you don't need a training course. You open it up and it's completely intuitive. And you can go from really never having used the software to being pretty much a power user literally within minutes. And we know this because people don't just come back once. They start using these pieces of software as part of their day-to-day routine in terms of clinical practice and their ongoing educational needs to keep up with their medical practice.
Now, each one of these apps must be downloaded individually in order to benefit from them. Is there anything in development that combines the best of all of the worlds in your apps as far as their class is concerned?
Yeah, so when we first started out, we actually built many apps. And what you see today is actually the result of a lot of consolidation. So our Calculate app is really meant to provide clinical decision support for effectively any clinical specialty. Anything from critical care to nephrology to cardiology to primary care to internal medicine. And that is the result of combining dozens of apps into a single application. We still have kept them to some degree separate in that we want different functions to have sort of different buttons on your phone. Mm-hmm. So consolidation, I guess, for convenience, but also differentiation, just to ensure that it's clear that each tool has a unique role.
Talk about the compatibility across platforms of your apps.
Yeah, so we're, in principle, device agnostic. And what we mean by that is we just want our software solutions to work and not have people have to worry too much about which device they're on. So if, for example, you're using Read and you get an email alert saying, hey, here's a critical paper that's just been published. If you're on your desktop computer and you click on a link, it'll take you into our web application. If you happen to be on an iOS device, like an iPhone or an iPad, it'll shoot you straight into the app itself, so you get that native app experience. If you're on an Android device, again, it drops you right into the Android device, the Android app. And so the idea being that we want to give people the best, most seamless experience, independent of which device they're on. So effectively, any device you're on, whether we have a native app or whether you're using a web browser with our web application, the solution just works. And this is great for people who have multiple devices. Let's say they're at their desktop when they're at office, but on their iPhone when they're doing hospital rounds, or even a hospital which wants to implement this solution for the entire organization. And maybe all they have is, say, an older set of computers with an older operating system, and it can only use our web application. So whatever the needs are of our end users, effectively the solution just works.
Are there instances within the app where you're getting notifications of new technology, new medications, new developments in healthcare as just sort of an FYI thing within any of these apps?
Absolutely. So we recognize that, if you have an app and you just install it, it's actually pretty easy to forget about it. So we're really focused on the whole idea of re-engagement. Just like Facebook might tell you that your friend posted a picture of their camping trip and which prompts you maybe to go have a look at that photo, we'll give you reminders, whether that's through a push notification or an in-app message or even a triggered email based on your interests, that there's new content relevant to you. So, for example, we recently released a new prognostic tool in a very rare form of lymphoma. Obviously, the cardiologists in our community probably aren't that interested, but those who work in oncology or hematology oncology obviously are very interested.
Absolutely.
So those automatic alerts go to the correct audience and not those who wouldn't find value. But we do recognize that we do have to help our users by reminding them of the outstanding content. But we don't want people to be deluded by information overload. So a lot of our energy and our back-end infrastructure is really focused on personalizing the alerts and the content, which we do share with you.
Now, you mentioned the back end. How much support do you offer to your clients, the folks that download this free app, this free software? Like you said, it's very easy to forget an app. Do you always keep your clients in mind when it comes to support?
Absolutely. So even though it's a free application, we do provide support because we are essentially have a global audience and a global company. We provide our support through email-based support mechanisms. So within the app or from our website, anyone can shoot us a note, and a member of our support team will always be happy to reply and help people troubleshoot. Some of the best feedback we get is from our end users, our frontline clinicians, and the feedback they give us through our support channels, in fact, drives new feature implementations or changes to the product that help our entire audience.
Now, where can we go online and get much more information about QxMD and your cutting-edge products?
If you go to QxMD.com, you'll learn everything you need to know and be able to download all of our software.
It's Dr. Neal Schwartz. He is one of the co-founders and medical director of QxMD, recognized as a leading developer of free medical software. Thank you so much for coming in and speaking with us today.
Thank you. Have a great day.
You do the same. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.